Hello, Niagara Region Public Health. My name is Kira Fenster, a public health emergency preparedness professional. Today I will be discussing the lessons learned, observed, and lost from the COVID-19 pandemic in the Niagara region. In this presentation, I will give a brief overview of COVID-19 in the Niagara region, define key types of lessons from the pandemic, and share local examples of each. The goal of this presentation is to determine what Niagara region did well during the pandemic and what they could improve on to strengthen emergency preparedness. Niagara region was one of the hardest hit areas during the pandemic, but was not declared a hotspot by the Ford government. The province also at one point deferred vaccines from the region, and these factors led to more deaths. Three types of lessons result from disasters. Lessons learned are problems that are identified and changes are made to processes and systems to address them. Lessons observed are problems that are documented but not yet acted on, so the same problems may repeat themselves. Finally, lessons lost are problems that are recorded but there is no follow-up, so the same problem will probably happen again. First, I'm going to talk about lessons learned. Niagara region learned the need to address health equity. Following the contact tracing on COVID-19 in seasonal agricultural workers in the Niagara region, the role of public health professionals expanded to full-on outbreak management. There were also dedicated mass vaccination clinics to prioritize access for these workers. Niagara region public health worked diligently with internal and external partners to better serve marginalized groups and built new meaningful relationships with many priority populations. After the pandemic, Niagara Health developed a strategic and health equity plan to reduce disparities and tailor care by working with specific patient populations, including Indigenous partners and Black communities. This is a lesson learned, showing how Niagara recognized and addressed health inequities during and after the pandemic. Next, I will be talking about lessons observed. Niagara region observed the importance of communication and building public trust. While the region itself and some municipalities like Niagara-on-the-Lake and Niagara Falls excelled in using clear, engaging content, others, including Port Colborne, West Lincoln, and Thorold, provided minimal updates, leading to inconsistent messaging across the region. These disparities in messaging, especially in vaccine communication, may have weakened public trust. To ensure citizens in all areas of the region receive the same communication during future crises, lower-tier municipalities should secure funding and plan for the presence of communication professionals, as well as better coordinate municipal communication strategies. This is a lesson observed as disparities in crisis communication were documented but not yet acted on. Lastly, I will be discussing lessons lost. A lesson lost was surveillance for priority populations. Although Niagara region public health surveillance systems for COVID-19 include health equity stratifiers, these were not mandatory fields, which resulted in poor data collection in regard to priority populations. Further, information and data sharing practices were sometimes slow and not streamlined, which negatively impacted the region's ability to share data in a meaningful way with health system partners. Surveillance systems must be strengthened, which includes collecting data on race, ethnicity, and socioeconomic conditions to better understand how some population groups are disproportionately affected by public health emergencies. This is a lesson lost because there has been a lack of follow-up on the strengthening of surveillance systems for priority populations. Thank you for listening, and I hope that these lessons can help Niagara region strengthen their emergency preparedness for the future.